we heard, I'm glad that Dr. Asamoto took a nice interview with you a couple of days ago, and you told us what you went through with the baby and all, and that was very helpful. But also, the most helpful thing is kind of how she's doing, what's going on, and what some of the pictures look like, and how it all fits together. Does it fit well? Yeah. And it actually does, and it is a very, she did suffer a bad brain injury. Now, it fits well because the pictures do show us that it is a diffuse and severe injury, and I'll explain what that means. Okay. But usually babies who suffered a bad injury start seizing because the brain cells have been hurt that bad. They are dying, and they are seizing when they die, or they create a seizure. And then the pictures show us what that extent of the injury. And now on the EEG, we've lowered the Versed a little. There's not many seizures, but a lot of the cells that cause seizures are not able to do it anymore because they're dying. Now, what does all that mean to you, right? Yes. What does that mean to Macy? When you have that severe of a brain injury, how is she going to breathe and eat and see? And those are very big questions. We think she is going to have a very hard time doing anything on her own from the extent of the injury. So that, I'll stop there because that's way too much for any mother to hear, right? And I think that when babies are getting ready for delivery, when things are happening, and it sounds like you detected something changing, that if the baby is for some reason not able to progress the way they should for their delivery, sometimes that causes a problem with the circulation to the baby's brain. And we all know if we don't get blood to our brain, that's just like having a stroke, right? Except for this is a stroke everywhere. So just, I'm going to stop talking. I'm going to show you the pictures and what they mean. And then I might go away and let you all talk a little, and then I can come back. Because sometimes just more and more information, and you need to kind of think and be with your family. Okay. So